back in 1963. It's 8:41 Tuesday, June 4th. We're glad to have in our studios today the Wake Forest Baptist emergency physician. She's a professor over there. Is that right? Sean?
Not a professor, but maybe one day.
Yeah, well, that's okay. So you're an emergency physician there. You're assistant medical director for Forsyth County EMS, and that is who you're representing today. Welcome, Dr. Sian Lewis. Good morning.
Good morning. Thank you for having me.
Hey, we're glad to have you in. Okay, now set this up for us. You say there is something we can all do that might help save someone in our family. Tell us a little bit about what you have in mind.
Yeah, so this week is CPR and AED Awareness Week. So we're trying to raise awareness about using CPR and AEDs in the situation of cardiac arrest. So in the whole country, there's about 350,000 sudden cardiac arrests each year. There's only a 10% survival rate. And in Forsyth County, last year we had about 360. We have a better survival rate here in Forsyth. We're about 13%, but on the EMS side, one of my jobs as assistant medical director is we're trying to improve that number. We're trying to improve outcomes. So some of the things that we're doing are CPR and AED awareness. We're working with the Sheriff's Department as well to start an AED drone delivery program where a drone will come to you with an AED to help facilitate getting patients better outcomes. So that's one of the projects we're working on. We're also, like I said, trying to improve awareness of CPR and bystander CPR, because there's a lot of data that shows that you're about 50% more likely to survive if someone does CPR before EMS gets there. And there could be up to maybe 10 minutes before EMS arrives, just depending on where you are.
And so the drone is going to be deployed from an EMS location, one of the Forsyth County facilities. Will they be stationed in multiple areas? How far along have you gotten with that?
So right now the program is starting out of Clemens, and so they'll be starting with the drone from the Sheriff's Department. They'll be flying it to wherever the location is. We're starting out just in Clemens, starting in the fall, but the goal is to essentially see if this is feasible and prove that it's helpful, and then we can hopefully expand to other places.
So there'll be tests and recording information, travel time, and that type of thing. We know that it's like when you hear the sirens come, you want to make sure you're moving over to the side of the road to let the vehicles, the emergency vehicles, come through. Same thing with technology. As the crow flies, you're probably going to get to a needed location more quickly than you would having an EMS vehicle travel out, even though that would already be dispatched, I would think.
Right, exactly, especially in our more rural areas where, we just don't have as much coverage for ambulances. It's going to take a lot longer with the rural roads. So getting something as the crow flies, like you said, is just much quicker. And so and we know from, studies that the quicker somebody can get an AED, the better the outcome, the higher likelihood of survival.
Now, a lot of us have heard that there's no longer a need to breathe for patients. In other words, mouth-to-mouth resuscitation. Hands-on CPR is enough. Has that made it easier to get people to take classes or to come along and help people in a cardiac arrest, like somebody that might fall in distress on the sidewalk out here on Trade Street, have somebody say, hey, I think I can assist at this moment, as time is of the essence?
Yeah, it's definitely made it easier, definitely made it more approachable for people to want to do this and be willing to do this, because there's no longer that mouth-to-mouth component. And we found that CPR, hands-only CPR, is just as effective as the old method where we taught mouth-to-mouth and breathing for the patient. So more people are much more willing to try. But another barrier now that we're seeing is just a fear of hurting someone or a fear of getting in trouble. But in general, if somebody truly is in cardiac arrest, you won't hurt them, they won't feel it, and the worst thing you can do is nothing. And so that's why we're really pushing for people to get trained in CPR, because the best you can do is better than nothing. And another thing that we're working on in the county is getting an app called Pulse Point, which, if people have it downloaded on their phone, will alert them to the nearest cardiac arrest if one comes out and it's close by to them, so that if you're in a restaurant or shopping and somebody across the street has called 911 for a cardiac arrest, you'll get that notification. If you feel comfortable doing CPR, you can go and help and do CPR before EMS gets there.
And you might be a half a block away, and so the technology, location technology that we have with mobile devices now will allow the ability to say, okay, here's where the issue is, and here's somebody that's right across the street.
Exactly.
And you'd be able to call. That's really great. You know, some of our audience members, folks listening, likely remember when CPR began, and you were instructed to do the breathing and compressions. Can seniors and super seniors perform CPR as we've heard instructed?
Yeah, absolutely. So as long as you are able to kneel on the ground next to a patient and be able to use your arms and basically straighten your elbows, you can do CPR. It can get tiring, but again, like I said, doing your best is the best you can, and it's always better than nothing.
There's a rhythm that you have to have. There's a process. You know, we appreciate you coming in today. Would you be able to kind of tell our listeners how to do CPR over the radio? I know there's a song that's out there.
Yeah, so
a dance song that is something that everybody knows, and you can go in and use that rhythm. Tell us a little bit about you know, how folks can do that.
Yeah, so the classic song that we teach with is Staying Alive. So, staying alive, staying alive. I'm not going to sing on the radio, but just a little bit.
That was good.
But so you can use that song to get the rhythm, but over the radio, let's see if we can do this. So CPR, you want to kneel next to the person as close as you can and check to see if they're conscious. And to do that, you can rub their sternum or their breastbone really hard, or you can pinch their skin really hard and see if they wake up. And if they don't wake up, check and see if they're breathing. And if they're breathing normally, that's good. But if they're not breathing at all, or if they're not breathing normally, maybe they're gasping or they seem like they're choking, that might be that they're in cardiac arrest. And so those are the patients that we want to start CPR on. So to do CPR, you want to take one hand and put it in the center of their chest, then take the other hand and put that hand over your first hand, straighten your elbows out so that they're locked, and then push down really hard in the center of their chest. You want to put your body weight behind it almost. And then you're going to push down and come back up and just keep pushing down hard and fast to that tune of Staying Alive. We also want to make sure that you call 911, because then we can get resources sent to you, and they'll also give you instructions over the phone.
That's good. And if you have a couple of people, because you always have people hanging around a situation where somebody's in distress, just sort of standing around. If you take the lead, if you have the confidence to be able to go in and you say to the guy standing at the foot, call 911, put them on speakerphone so I can get some information, then you continue to do the compressions. So how can people get in touch with a class or more information from your department?
Yeah, so, I think it's important that people do get some training on this. 70% of cardiac arrests happen in the home. So the person that you're most likely to do this for is somebody that you live with, or a family member, or somebody that you care about. So I think it's really important to get that training and encourage your family, everyone from the seniors, the grandparents, to the kids and the grandkids can learn CPR and do CPR effectively. So if you look up CPR classes, there's CPR classes through multiple different agencies. You can reach out to Forsyth EMS for resources. You can go to our website. You can reach out to the AHA. They offer classes as well. A lot of different community places, churches, schools, get organized CPR classes as well. So look them up, find them. A lot of them are free. Take your family, take your friends, because you never know when you're going to need this skill to help save a life.
Yeah, Forsyth.cc, and look for the emergency medical section, and there you go, and that's it. I think that's wonderful, and we appreciate you so much coming in today. Is there anything else you'd like to let our listeners know about this morning, Sean?
Just that, again, make sure you're telling your friends and family about this, because it's really important. It's basically the biggest thing that we can do in cardiac arrest to save a life is early CPR.
That's fantastic. We appreciate you coming in today. We really do. And thank you so much. And good luck this summer and all throughout the year in the efforts that you're making here in our community.
Thank you very much.
We appreciate it.
Thank you.
Dr. Sian Lewis, Wake Forest Baptist Emergency Physician and Assistant Medical Director for Forsyth County, here today to talk about the CPR and AEDs and so on, and the drones. And that's pretty exciting, isn't it? It's 8:52, time to check that traffic.